So this short video is on radiological anatomy of skull and basically head and neck region. So you can see in radiology of skull we take two types of x-rays, the plain x-rays and the special x-rays. So basically special x-rays includes the angiography, in which we see the vessels in head and neck region, and this special x-ray, that is angiography, is done to detect the occlusion or thrombosis, and intravenously the dye is injected to the patient, and these x-rays are taken. But our area of concern is plain x-rays, so we are going to study about plain x-rays of head and neck region, skull and neck region also. So there are different views which we study in plain x-ray. So what are those? Those are AP views, lateral views, and the PA views. AP views are good, but because of higher amount of radiation exposure to the nose, to the eyes, this is avoided, and basically done for cervical vertebrae and fracture of skull. And in lateral view, this is for general survey of skull including the cervical vertebrae. And posterior anterior view, we see there are two positions which we use, that is Waters position and Caldwell's position. Waters position is for seeing the paranasal sinuses, okay, and this is also for paranasal sinuses, especially from frontal and ethmoid. So that ethmoid sinus के लिए generally हम Caldwell position में करते हैं. There is minor difference between these two, we will see later. In the anterior posterior view of skull, here you can see this is the vault area, and in vault area we can see two tables, not clearly seen here, but next x-ray we will show you. This is the coronal suture, this is the area of sagittal suture, and somewhere lambdoid suture should be seen here, but it's not being shown here. So what we see clearly in AP view is this is your frontal sinus, this is the area of crista galli, this is ethmoid, cribriform plate of ethmoid, orbital margins you can see, and here you will see this is the greater wing of sphenoid, and this is lesser wing of sphenoid. Now you can see here the nasal septum, and one concha is this superior concha, and this is middle concha, and this one is inferior concha. And here you can see the lateral wall of nose, and this is your maxillary sinus. Here you can see maxillary sinus, and this is your petrous temporal bone seen in relation to orbit here. Some part of zygomatic bone is seen here, this is zygomatic bone. And here you can see the inferior alveolar superior alveolar margin, here the upper jaw teeth, and this is the ramus of mandible, angle of mandible, base of mandible, okay. Next, in which can you identify all the things? So this is the outer table, this is the inner table, this is the area of diploid. What is diploid? Diploid is basically a spongy bone in which the diploic veins are running initially at the time of birth. You can see this vault bone is unilamellar, there is only one table. In first 3 years of life it happens to be unilamellar, and during the 4th year of life the two tables are formed, so the outer table and the inner table. Now the differentiation reaches to its maximum at the age of 35 years age, and you will see the diploic veins running within this. Okay, now once again, this is your coronal suture, the sagittal suture, part of lambdoid suture seen here. This is your frontal ear sinuses, crista galli, cribriform plate, nasal septum, the middle concha, the superior concha, the part of labyrinth of ethmoid, the inferior nasal concha, the orbital margin, the lesser wing of sphenoid, the greater wing of sphenoid, the petrous temporal bone, the zygomatic bone, anterior nasal spine, area of hard palate, Now in the area of mouth, you will see this is the dense, the part of second cervical vertebrae, and here you see the mastoid, and this black area here looks black or translucent. So this black area is basically mastoid ear cells. Here you have seen this sinus, this is maxillary ear sinus, this is maxillary ear sinus. Here you see the ramus of mandible, the angle of mandible, the base of mandible. Now in lateral wall, lateral view of skull, you see the rays are coming from lateral side and the film is on the other side of the patient. So the patient is in between the ray and the film. So in lateral view, before we check it, we can see it here. Now what we expect to see is the frontal air sinuses, the diploid, the outer table, the inner table, which is more prone for fractures. You can see the coronal suture. Just behind coronal suture there is a marking for anterior division of middle meningeal artery. Now here you see this triangular bone, which is a part of temporal bone. This is the petrous temporal bone. The internal acoustic meatus, you expect to see the external acoustic meatus will be superimposing in the center of this bone. Now here see the anterior clinoid process, the posterior clinoid process. Now the hypophyseal fossa. In body of sphenoid you will see this air filled area. This is sphenoidal air sinuses with multiple cells present, air cells present here. Now you can see this is the crista galli, this is the orbital plate of frontal bone, and यहाँ दो दिखाई देंगी क्योंकि उस साइड की भी ओवरलैप कर रही होगी. And here you can see the internal occipital protuberance. यहाँ पर तो नहीं इतने अच्छे से दिखाई दे रहा, but in X-ray you can see all these things. So here we see the frontal air sinus, the orbital plate of frontal bone, inner and outer table, the diploid, the coronal suture, the groove for the lining marking for the anterior division of middle meningeal artery, anterior clinoid process, the hypophyseal fossa, the posterior clinoid process. Here you see this triangular thick bone is petrous temporal bone. This black area representing the mastoid air cells. This is external acoustic meatus. This is the margin of auricle. Here you see the internal occipital protuberance, the external occipital protuberance, and after frontal you will see this area is for ethmoidal air sinuses and this is for sphenoidal air sinuses. Okay, what about this? This is your maxillary air sinus, and this is the side of mandible, ramus of mandible. And here you see this is the anterior arch of atlas, first cervical vertebrae. This is the posterior arch, and this is the dens which belongs to second cervical vertebrae, and this is your second cervical vertebrae. Now this X-ray you have to identify outer table, inner table, diploid, coronal suture, anterior division of middle meningeal artery, and frontal air sinus, orbital plate of frontal bone, anterior clinoid process, posterior clinoid process, and hypophyseal fossa, the clivus, the petrous part of temporal bone, the mastoid air cells, the internal and external acoustic meatuses, the auricle. Yes, here you can see the internal occipital protuberance, the external occipital protuberance, and you can see, yeah, the frontal, the ethmoid air sinuses, the sphenoid air sinuses, the maxillary, the hard palate, the upper, the alveolar margin of maxilla, the alveolar margin of mandible, C1, dens of C2, C2, C3, C4. In Waters view, this view is done for paranasal sinuses. इसमें करते क्या है, पेशेंट को चिन टच करने को बोलते हैं फिल्म पे, और रेज आ रही होती हैं ऑक्सीपिट से मेंटल की तरफ. सो दिस इज ऑल्सो नोन एज ऑक्सीपिटो मेंटल व्यू. इसमें जैसे पानी पीते हैं ना, उसी तरीके से अपने माउथ को उठाया है, फोरहेड को पीछे की तरफ ले गए, बेसिकली गर्दन को एक्सटेंड किया हुआ है. सो एंड दिस इज़ द एंगल फिल्म का जो बनना चाहिए. तो दिस एरिया इज़ फॉर पासिंग द रेज. ऑक्सीपिटो मेंटल जोन में जाती है. तो पैरानेजल साइनसेस होते क्या है कि पैरानेजल मतलब अराउंड नोजल कैविटी देयर आर एयर फिल्ड स्पेसेस. नाउ सारे के सारे लेटरल वॉल ऑफ नोज में खुल रहे होते हैं, एंड यू विल सी दीज पैरानेजल साइनसेस आर टू मेक द स्कल लाइटर. बट यहाँ पर इन्फेक्शन हो जाए, कुछ फ्लूइड आ जाए, साइनोसाइटिस हो जाए, इन दोज केसेस यू नो दिस वर्क विल बी हैम्पर्ड. सो एट बर्थ ज़्यादातर पैरानेजल साइनसेस प्रेजेंट नहीं होते हैं. 6 to 7 years पर एवरेज दे स्टार्ट अपीयरिंग एंड प्यूबर्टी तक प्रॉपर ग्रो कर जाते हैं. सबसे पहले जो है, जो सबसे बड़ा साइनस है वो मैक्सिलरी साइनस अपीयर होता है, और बाकी फ्रंटल साइनसेस वगैरह भी बर्थ से नहीं होते. 7-8 years पे स्टार्ट होके प्यूबर्टी तक जाते हैं. तो फिर यहाँ पर से फिर से देखेंगे आउटर टेबल, इनर टेबल, डिप्लॉय, सजाइटल सूचर, the frontal sinus, the frontal sinus, okay. And here you see the nasal septum. This is the orbital margin. This is Waters view, no? Waters view. This is the greater wing. This is the lesser wing, you see. And this is here greater wing and lesser wing. And this is the area of zygomatic bone. This is the floor of orbit. And this is the lateral wall of nose. So you see this pyramidal sinus, this sinus is maxillary sinus. So basically base is in relation to the lateral wall of nose, roof in relation to the orbit, floor of orbit, and laterally you see zygomatic bone is coming in its relation. The floor is upper alveolar arch, okay. Now this sinus also drain into lateral wall of nose. Here also this is your maxillary sinus, the zygomatic bone here seen. Now what about this bone जो यहाँ से इस तरह से ये bone जा रही, this is your petrous bone. This is your petrous bone. Okay, here you can see the dens, not very clearly seen. This is the margin of mandible, and this is margin of occiput. This is the mandible angle of mandible, and these are the soft tissue shadows. Very fast we will revise. This is frontal sinus, the crista galli, the nasal septum. Oh, this open mouth area is showing this beautiful sinus with the septa in between. This is your sphenoidal air sinus. This is once again maxillary and air sinus. Don't get confused with this. This is basically intratemporal area which is seen here, and here also you can see dens very clearly. First vertebra you can see here. This is your occiput, and this is margin of base of mandible. And what else you can see here? This is our orbit, margin of orbit. You can see here the petrous bone will be lying here. Okay, similar is this X-ray also. This is nasal septum, ethmoidal air sinuses seen here. This is your maxillary sinus, and here you can see this is the area of upper alveolar arch, the greater wing, the lesser wing, the frontal sinuses, you know, all these things you can see here. And this is dense here in the area of open mouth. You can see upper incisor as well. Now here a very different view, that is Caldwell view for paranasal sinuses and basically for ethmoidal. And here the rays are passing from occiput to frontal area. So this is occiput to frontal view also. These are all PA views types. Waters and Caldwell's are PA view only. And you see the face is touching the film, the forehead and the nose both are touching the X-ray film. Here you can see the lambdoid suture very clearly, the sagittal suture very clearly, the coronal suture part of it you can see. This is the crista galli, this is the frontal sinus seen here, orbital margin, the lesser wing, the greater wing, the nasal septum, the inferior concave, the middle and the superior concave, ethmoidal air cells. All these cells are ethmoidal air cells. Now you can see here the petrous bone is coming in lower part of orbit. So this is difference from the Waters view. So in Waters view you see maxillary sinuses से नीचे देखने को मिल रही थी पीट्रस टेम्पोरल बोन. यहाँ पर पीट्रस क्योंकि फेस इस तरह से रखा हुआ है तो पीट्रस जो है ऑर्बिट के रिलेशन में शो करती है. तो दिस एरिया इज maxillary sinus. Now in APN lateral view of skull and cervical region you can see in this area, this is your trachea का shadow जहाँ पर air होती है वो black दिखाई देती है. और this is your C7, C6, C5, C4, C3, C2 और C2 से ही निकलता हुआ ये जा रहा है dense. ठीक है, ये margin of mandible है. This is angle of mandible, ramus of mandible. What are these joints? Zygapophysis joint superior articular facet और inferior articular facet के बीच में होते हैं. ये transverse processes दिखाई दे रहे हैं. Lateral view में अगर हम देखेंगे तो this is your anterior arch of first vertebrae, this is posterior arch, and you can see this is the dens which was part of C2, and these rounded areas are basically pedicles. ये जो areas दिख रहे हैं वो pedicles हैं. ये सारे के सारे spines हैं. And you will see vertebra prominence is this is C7, the most horizontal and longest spine. So here can you identify all these things? ये spines दिख रहे हैं. थोड़े सा पेशेंट शायद टेढ़ा हो गया, इसकी वजह से ये स्पाइंस कुछ इस तरह से दिखाई दे रहे हैं. ये एरिया है लैरिंग्स में एयर है, ये एरिया है ट्रैकिया का. लैरिंग्स C3 to C6 तक जाती है तो वो वाला एरिया यहाँ पर हम देखेंगे. तो दिस इज योर C2 डेंस, दिस इज C1 एंटीरियर आर्च, पोस्टीरियर आर्च. So C1, C2, C3, C4, C5, C6. So this is your C6, this is your C3. तो larynx यहाँ इस एरिया से इस एरिया तक जा रही है. You can see the epiglottis. This is the epiglottis, and here you can see the laryngeal cavity. ये पूरा air larynx में है. ये vestibular fold, vocal fold, ये ventricle दिख रहा है. ये एरिया यहाँ तक आपका है पूरा, सॉरी यहाँ तक है लैरिंग्स. उसके बाद ये ट्रैकिया स्टार्ट हो जाता है. ये सॉफ्ट टिश्यू है, ये सॉफ्ट टिश्यू का शैडो है. व्हाट इज दिस बोन? दिस इज योर हायट बोन. ये बोन हायट बोन है. नाउ यू कैन सी दिस इज C7 vertebra prominence, and C7, C6, C5, C4, C3, C2 and C1. Same you can see here. C7 vertebra prominence, C6, C5, C4, C3, C2, C1. This is dens, this is margin of auricle, this bone is petrous temporal bone. Okay, and this is your ramus of mandible, base of mandible, all the things. Thanks for watching.